Thank you very much, Swami Sir, for the warm welcome and Father Manoj for giving me this opportunity. And my topic is not exactly clinical, but more of a community-oriented kind of topic because I have been exposed to these kind of things for several years. I have almost 30 years of experience in medical field, in medical colleges, primary health centers, community health centers, corporates, international and national level. And my last corporate posting was in Astor Group at DMU's Medical College as a Chief Operating Officer. And from my experience, whatever I'm going to say may create some thought processes and you may have a different opinion, but whatever I am saying is what I've experienced personally. It is not a collection of data from various sources, it is my personal experience. Okay. So I started with a disclaimer because what I'm going to say is a pan-India thing and not related to Kerala alone. And as far as economically, I consider Kerala not as part of India because Kerala has lost its glorious past and now is just an appendage to India economically. Otherwise, there are a lot of things with Kerala that is far ahead of India in various standards. So I start with my first. This is going to be a elocution. My elocution is a bit rusty. I hope you will excuse me for that. And I have written an essay, a 4-page essay, and I will read it out to you. And I'll try to help you with some images that will support what I read. So it was the best of times and it was the worst of times. This is a famous statement by the great English author Charles Dickens. And I am saying this in context to the year 1632. I would like to reiterate the famous Charles Dickens quote which seems appropriate at this time. That is the year 1632. This year marks a crucial insight into the psyche of Indian population and the rulers who led them as kings and emperors. Emperor Shah Jahan's favorite queen, Mumtaz Mahal, died delivering her 14th child due to postpartum hemorrhage. And the profusely bereaved emperor built a mausoleum in her remembrance and named it the Taj Mahal. That he had multiple wives and concubines and that he continued to father several children after Mumtaz's death makes a mockery of the testimony that the Taj Mahal is a symbol of eternal love. It stood as a pure white monument against a backdrop of poverty, illiteracy, ignorance, famine, plague, smallpox, malaria, leprosy, tuberculosis, hepatitis, cholera, typhoid, poor sanitation, untouchability, drought and death compounded by unscientific treatment modalities and beliefs and practices of Neem Hakims, whites and faith healers. Scientific temper, scientific thought and practices few and far between. That Shah Jahan ruled one of the richest and greatest empires in the world is eclipsed by the fact that an abysmal value was acceded to human life. There was gross suffering of its people, particularly where public health was concerned. Today, centuries later, we, the people of this country, still collectively carry this burden hidden in our statistics, away from the public attention, media, soothsaying parliamentarians, arrogant, corrupt and well-fed bureaucrats. 120 women died today every day from postpartum hemorrhage in contemporary India. In contrast, the death of Queen Isabella of Spain, who died in a similar circumstance, around the same time struck the collective consciousness of Spain's society and its rulers. Perhaps that was the seed that sprouted in their minds, along with the growth of science and scientific temper in Europe, that nurtured them to develop nursing homes, maternity care centers, and train their nurses in modern scientific approach. Today, Spain has one of the best public healthcare systems in the world, with a maternal mortality rate of 3 compared to India at 97. Healthcare was never a priority for rulers in medieval India, the British India, or even the post-independent modern India. The first budget did not have any specific allocation for healthcare, and this year's allocation is just 1.6% of GDP, whereas in China it is 7%, US it is 17.3%, UK it is 11.3%, Spain 8.9%, and the EU average is 9.8%. Value of human life was abysmally low, and even today, 5,000 children die every day in the land of Kama Sutra, where the Indian males are busy sexing up their wives to produce 2 children every 3 seconds, forcing Winston Churchill to notoriously state that he hated Indians because they bred like rabbits. Truly, this hatred was evidenced by the Great Bengal Famine in 1943, when 40 lakh Indians, more than half the equivalent of Holocaust victims of Nazi Germany, perished without any trace or memorial in their remembrance. Opinion may vary as to how a land surplus with rice was devastated when Churchill carried away shiploads of rice from the hard-working Indian peasants to satiate his men who were being slaughtered by Hitler's army in Europe during the Second World War. Bankim Chand Chatterjee, the renowned Bengali writer, had a great foresight when he wrote his epic novel Ananda Amrit, giving us the first song of Indian independence, Vande Mataram. In 1943, when the British government in India asked Sir Joseph William Morey to prepare a status report on the health condition in India for initiating reforms aiming to provide health services to all, though mainly their British subjects in India, a time when it is jokingly referred that you had to take a bus to London to get a tablet of paracetamol. Sir Joseph William Moore, along with some eminent scholars and professionals, travelled all over the country to painstakingly prepare the report, later to be known as a Moore Committee report. 3 years later, in 1946, the report was submitted to the British government, which, once a great empire where the sun never set, was then tottering under the onslaught of freedom movement led by Mahatma Gandhi. The report famously stated that if it was possible to evaluate the loss which this country annually suffers through avoidable waste of human material and lowering of human efficiency, through malnutrition and preventable morbidity, we feel that the result would be so startling that the whole country would be aroused and would not rest until a radical change has been brought about. 2 years after India became republic in 1952, the young government in India took up the public health challenge in all sincerity and vigor, which later, like all programs, lacked follow-through, losing steam halfway, the initial visionaries being replaced by half-hearted imbeciles, both in government and bureaucracy. Health aiming to fill their pockets. The program of public health was by 1980 akin to a terminally ill patient, occasionally gasping for breath, the patients, doctors and staff being victims of a flawed system that had collapsed. The primary, secondary public health system imploded, leaving rural patients clamoring for care at faraway higher centers like district hospitals and medical colleges. To implicate the medical fraternity for the failure of public healthcare system would be a travesty of justice, when the sub-centers, primary health centers and community centers, and to some extent the district hospitals, did not get any financial infrastructure or logistic support from the bureaucracy or the politicians. Lack of roads, electricity, transport, water supply, along with poor foresight and planning for capacity building, frustrated the doctors, nurses and healthcare workers, thus denying adequate and quality care to the patients. Delivering preventive, primary and secondary care to the far-flung and inaccessible areas in the massive and barren Indian subcontinent was limited, or no last-mile connectivity was a Herculean task that demotivated even the die-hard and committed workers. All India Institute of Medical Sciences was established in Delhi in 1956, followed by establishment of several colleges in all states of India. The primary aim was to produce doctors to create a healthy doctor-population ratio. The medical colleges were supposed to be teaching centers, not treating centers. They were to act as a last referral point for PSC, CHC and district hospitals. But when the primary, secondary and tertiary centers failed to deliver adequate services, sick people from villages had no option but to travel to distant medical colleges in cities. Churning out more and more doctors who were least bothered to serve in villages improved the ratio, but not the distribution. 80% of India lives in its villages and 80% of doctors live in the cities. The claim of the present government that India has achieved a doctor population ratio of 1:834 as of today against the WHO recommendation of 1:1000 is laughable. The government has listed all registered medical practitioners, including Ayush, against the present Indian population, not taking into consideration if these doctors are alive, practicing, or living in the country or their current location in India. Shakespeare's comedy of errors would pale in comparison with the habitual data manipulation by the government. During the 80s and 90s, the government services imploded under the onslaught of burgeoning population. The primary and secondary services going haywire, the medical colleges bursting in the seam and struggling to provide adequate and timely services to patients. Quality took a backseat, and dying at a medical college was accepted as a norm without any protest by a desperate and deprived population. This vacuum urged in an era of nursing homes, polyclinic and private hospitals, run by groups or individuals. The patients deprived of services started clamoring at the doors of private centers, who never missed a chance to squeeze them dry. For patients and bystanders, it was a catch-22 situation like being caught between the devil and the deep sea. The socio-political-economic landscape of post-independent India was a testing laboratory for various shades of democracy, mixed with communism, socialism, capitalism that waxed and waned depending upon the whims and fancies of its rulers. The only consistent thing that Indian democracy had was its inconsistency. The plight of the Indian voter was best described by the famous Hindi writer and political satirist, late Sri Harishankar Prasad. This is what he said. भारतीय मतदाता का विकल्प एक गरीब आदमी के समान है, जिसके पास केवल 2 फटे हुए बनियान हैं। वह एक पहनता है जबकि दूसरे को धोया और सुखाया जा रहा है। The Indian voter's choice is like that of a poor man who has only 2 torn vests. He wears one while the other is being washed and dried. When nothing seemed to work, the financial burden of the country became insurmountable. The desperate government by early 90s mortgaged its gold reserves to save the economy. An immature and vulnerable India was forced to open its borders to liberalization and free market economy. The country that had a history of repeated invasions and loot was once again invaded financially by multinationals and business conglomerates. The healthcare sector had a boom in the market when major corporates established themselves. Indians were now exposed to high quality healthcare, including advanced technologies, diagnostics, infrastructure, specialties, super specialties, tertiary and quaternary centers, but located exclusively in major cities. The plight of the average Indian was like a beggar, hungry beggar standing in front of a 5-star hotel. The majority of the population still hoped that the government would save them from disease and death. The much touted slogan of Health for All by AD 2000 was but a distant dream. Today, more than 75% of health care in India is delivered by the private sector, a conglomerate of various inconsistent players of all shapes and sizes, starting from clinics, polyclinics, nursing homes, specialty, super specialty, tertiary, up to quaternary care, 5-star hospitals, while the government stands as a mute spectator. In a desperate attempt to maintain standards and a resemblance of sanity, the government started QCI and followed by NABH, which was a diluted version of JCI. Even that was a far cry for Indian hospitals, and to entice them into the field, NABH had to further reduce the standards to entry level. However, what started as a roar ended in a whimper as the combined onslaught of corruption and political virus reduced NABH to just a window dressing. Thus, free health became unavailable and quality healthcare became unaffordable. This forced the government to take up health insurance like RSVY, Ayushman Bharat and CASP. This was launched with great fanfare, and the government touted this as a final solution to provide best possible health services to the poorest and poor, where patient can get treatment from any empaneled hospital for free. This initially worked well in a state like Kerala, where affordability could be combined with accessibility. However, in the massive rural landscape of Indian subcontinent, the poor could not access the services in far-off cities and towns. For the Indian rural masses, Ayushman Bharat was like filling up the tank of petrol with a vehicle with no tires. The government fund was conveniently packed with private business groups like Reliance and ICICI, who were reluctant to part with that money. Meanwhile, in urban India, the government insurance policy got off to a great start as many private hospitals got empaneled. However, the government did not keep its side of promise of paying the hospital on time, causing many hospitals to de-empanel, forcing patients to go for out-of-pocket spending, which satirically is called OOPS. While the government schemes covered only the BPL, the middle class was forced to opt for private insurance. Third-party administrator or TPA was brought in as an act of parliament, and those in nexus with the politicians took up managing crores of insurance funds. The Indian population as of today is divided into three categories. Upper class, for whom healthcare is accessible and affordable. Middle class, for whom it is accessible but not affordable. And the lower class, where it is neither accessible nor affordable. By 2010, unable to start and sustain new medical colleges, the government opened gates to private medical colleges to be supervised by MCA. Investors, business groups, black marketers, crooks of all shades, along with corrupt politicians, used this opportunity for money laundering. Medical Council of India achieved the notoriety of becoming one of the most corrupt organizations in India. Between 2010 and 2015, the residences of many doctors were raided. They were arrested by CBI, convicted by the court, and put behind bars. These doctors kept running the show even from behind bars, and it's alleged that they had sufficient financial clout to fund the elections of several politicians, some of who are presently in the current government. The MC had to be disbanded and was replaced temporarily by a board of governors till the formation of NMC in 2018. Which wouldn't make any difference, as the notorious Inspector Raj continued and was simply old wine in new bottle. MEMC became an extortion racket as the extremely difficult norm set up by it encouraged corruption. Between 2010 and 2020, several substandard medical colleges sprouted all over India, many of them later shut shop. The health services and the health education system is now overshadowed with private players, with the government standing as a mute spectator. The faith in public health care system is almost gone. But every cloud has a silver lining. During the 77 years of Indian independence, there has been several achievements too. Our health indices like IMR, MMR, life expectancy, and socioeconomic indices like HDI have become better since 1947. The national health programs revised over a period of several five-year plans have seen eradication and control of several infectious diseases. Massive and one of the largest vaccination drives was conducted in India. Modification of patent laws in pharma industry has set a boom in manufacturing, and India is now one of the largest manufacturer of cheaper generics and branded drugs. Medical consumables and medical equipments have developed substantial growth. India is also one of the largest exporters of nursing manpower. However, these achievements are too little, too late. Many countries that were devastated during the Second World War started from scratch around the same time when India achieved its independence. They now have some of the most advanced healthcare services in the world, in services, education, and research. All these countries have a combination of public and private. Health insurance plays a major role and is accessible and dependable both for patients and hospitals. Our track record has been a history of fails and misses. We need a pandemic or an epidemic to occasionally rise from our slumber. Massive loss of human life or human resource never makes headlines in a generation which is busy swiping reels on Instagram. Occasional death of a Dr. Vandana Das is too insignificant to strike the collective consciousness of a fraternity or leaders, where protocol, presence of mind, and a piece of rubber tubing could have saved the life of a young and budding doctor, whose profound, poignant, and painful memory will soon be forgotten and dumped into the dustbin of history. Thank you and Thank you.
This course was a critique of the entire system of the days humanity came into being.
Yeah.
And what we must understand is, if we are reading about a situation where people are free from complaints or shortcomings, there should be a social system that is totally dedicated to the welfare of people. And so, what is that system? It's a system that produces according to need and consumes according to need. It is not something the other way around which is happening. Demand, actually, earlier demand was to this production, availability, demand supply. Now the situation is just the opposite. Supply has to create demand, and that is the market economy that we see around us the world over. So, if it is about providing hassle-free and absolutely, what should I say, a system which is not having any fault, a faultless system, then we should develop a social system which is catering to the needs of the people and not to the greed of a few centers or individuals or corporations. So, which is that system?
I think
That system is what you were mentioning casually. In the quagmire of ideological contradictions like communism, socialism, and capitalism, all these things are, I would say that a just social system is what is called socialism. And that alone, as and when it comes over decades, centuries, or millennia, that only is going to provide the needs of the people.
Sir, you mentioned the needs of people twice. This sentence is mentioned in our community medicine textbook, the felt need of the people. That has never been done because, you see, we spend more money on missiles than medicines. How many Pakistani kills Indian? How many Chinese kills Indian? But Indians are killed by hepatitis, tuberculosis, AIDS, HIV, everything. But we don't spend money on that. Our priority is different. Our GDP 1.6% is very laughable. US is 17%, China it is 7%, Europe it is 8%. So we are spending 1.6% of GDP on healthcare, and we are spending more money on defense. Right? That is the first thing that we should do. Second, doctors cannot solve the problem because the doctor needs. I will tell you one example. I was working in Meenangadi CSC and I was posted in a sub center, and a patient came to me with a lacerated wound. I wanted to stitch the patient. There is no suture thread there. And you know what the sister did? Sister went and broke an IV needle and put a thread through the back of the needle, bent the needle and gave it to me for suture. That is in Wayanad, somewhere nearby, I won't tell the name. The IV line, that needle, she took artery forceps, she broke the needle and put a thread behind the needle, bent the needle and gave me for suture. A few kilometers from here in Kerala. Now you know the condition of what is in the rest of India. The doctors cannot be blamed. Doctors are doing clerical work than clinical work in government sector. They are busy doing a lot of other things than caring for the patient. They are not supported. They don't have support. They don't have roads. They don't have electricity. They don't have ambulances. They don't have medicine. They don't have pharmacies. They don't have X-ray. What can a doctor do?
No, it's not about just doctors.
You can't blame the doctors for that.
Save the situation. It's a system that has to change in all its dimensions. So that's what I'm telling you. A system that is geared to meet the needs of the people and not to greed of a few power centers.
But if I'm illiterate and uneducated, how will you know that my need is this, my disease is this, and this is the right doctor for? How can I know that? I'll go to some local what is called Deem Hakims and Vice and local fraud practitioners. He will pay 10 rupees and try to solve my problem. If I'm ignorant, then I don't know. The first thing is ignorance. Second is availability. Third is affordability. If these three things can be covered, the problem can be solved. The thing about Kerala is that people are not ignorant. So they know their needs, they can identify their needs, they can identify the person who can solve their needs, and they can go there because they have access to that place. The roads are there, the bus is there, the auto is there, they can go there. It's a small state. But if you go to a place like Chhattisgarh, or if you go to Maharashtra, or even Telangana or Andhra, one village of maybe 1,000 people are staying, and the next village may be 100 kilometers from there. City may be 250 kilometers from there. There's no roads, no electricity, nothing.
No, across the world, it is about a system that is catering to the needs, identifying the needs of the people and working for the needs of the people. So, it is that which has to be corrected and not individual situations where the situation of the nurse providing a livelihood and all that. This is all.
I'm just saying my experience from what I know.
These are all manifestations of a system that has gone awry. And then one more thing was telling about Kerala's.
No, we'll talk about it.
We'll talk about it later. നാട്ടുകാരെ കുരുമുളകിലേക്ക് പോയിട്ടുള്ള നാട്ടുകാരെ ഉണ്ടാകാൻ പറ്റുന്ന സാമൂഹിക ഇപ്പൊ നാട്ടുകാരെ തന്നെ ഇവിടെ കുയിലുള്ള ഒരു അവസ്ഥയിലാണ് ഇതും ഇന്ന് നമ്മള് ലോകം നോട്ട് ജസ്റ്റ് കേരള ഇന്ത്യ ലോകം അനുഭവിച്ചിരിക്കുന്ന വലിയ പ്രതിസന്ധി മാനിഫെസ്റ്റേഷൻ ഓഫ് എ ബിഗ് ക്രൈസിസ് ദാറ്റ് ദി എൻറ്റയർ വേൾഡ് ഈസ് ഫേസിംഗ്. ദുബായിൽ ഭയങ്കര ഫ്ലഡാണ്. ദുബായിൽ വെള്ളം ഒഴിച്ച് വർഷമായിട്ടുണ്ട്. In Kerala we are facing drought. Puൽപ്പള്ളിയിൽ പ്രളയം. So we should try to understand why these things are happening. Humanity surviving, humankind surviving. എന്തൊക്കെ ഇന്റർനാഷണൽസ് ആണ്, എന്തൊക്കെ ചെയ്ത ഫാക്ടറീസ് ആണ്, ആത്മഹത്യ. Anyway, you gave a lot of food for thought.
Thank you very much. And I want to thank Angel for supporting me in this presentation. Thank you, Angel.